Almost a quarter of the world's adult population has chronic back pain. Now, as a movement specialist who works with people with chronic pain, I'm motivated to try and find out why that is and what can we do to help with chronic low back pain. So there are a couple of things I've observed over 15 years of working with chronic pain patients is two things. First of all, we're often given exercises to help with our low back pain or back pain, which involve exercises maybe like planks, Superman, bear lifts or bridges. Okay, now these are all great exercises on their own. They're brilliant exercises, but in my opinion, not when you're dealing with chronic back pain for a number of reasons. So I think these are great exercises, and the exercises I'm talking about, and you may have been given them yourself to deal with your back pain, are things like this. So Superman or Spider-Man it's called. So you reach out and then you lift the opposite arm and leg. Okay, so that might be one exercise that you're familiar with. You might also have been given something like a bear lift, where you lift and hover your knees off the floor. Okay, and you may have been given a plank, or you may have been given something like this, a bridge position, where you're told to squeeze your glutes and push yourself up into the air. Okay, so those might all be really familiar exercises to you, and you can Google back pain exercises and you'll probably see similar things like this coming up. Now, in my opinion, these are not the first line of exercises we should be doing if we have back pain, because these exercises are designed to stiffen the tissue. They're designed to stiffen the back, because the theory is that if you stiffen the back, your back pain will go away. Okay, but as you can see, almost 25% of the world's adult population has chronic back pain. So it doesn't look like that's working too well for that. What I believe we need to do, and I've worked since 2008 with chronic pain patients, is we shouldn't go in at the stiffening level. What we need to be doing is actually softening the tissue first before we get to the stability and the strengthening and the stiffening, if we want to call it stiffening. Okay, because our body needs dynamic movement. Now, if you've been in pain, and if you've got chronic pain, obviously that's pain that's been there for over 3 months, and maybe you're watching this and you've had pain for years and years, your pain signals have been ramped up. Your nervous system is very vigilant, it's very active, looking for threats, looking for danger. Your nervous system does not feel safe. Now, if that's the case, your tissue is going to respond, and your tissue is going to get tighter. It may be going into spasm, it will be shortening and contracting. So it's getting kind of sort of rigid, okay? Now, if you start doing stiffening exercises or movements designed to create stiffness, that's just going to layer on more tension on top of muscle tissue that's already tense. So in my method, the integral movement method, which is what MoveLight is based on, takes a totally novel and new approach to managing chronic pain. And as I say, I've worked with people since 2008, and it's really has fantastic results in helping people reduce their pain and get back to living the life they want to live. So I'm going to show you a few little exercises that will help you with this concept of softening the tissue, relaxing the tissue a little bit, calming the nervous system down, so that you can then, from a quieter place, start to build on stability and strength. So I'm not saying that planks are a bad thing, or that Spider-Man or Superman is a bad thing. I think they're great exercises, but they have to come at the right time. So that's point number one in my many, many years of clinical experience working with these chronic pain patients. My second observation, and this is a theory that still goes around, is this concept of core stability. Now, if you've got back pain, you may have been told you have a weak core and you need to strengthen your core and you need to engage your core by drawing in your tummy muscles, navel to spine, pulling up your pelvic floor. That is what people call the core, this sort of pelvic girdle. Transverse abdominis is a word you might have heard. Now, there is actually no evidence, which is the scary thing. There is no proven research that a weak core causes back pain or that strengthening your core will help alleviate back pain. So we have to ask, why are we still doing this when there's no actual proven results or evidence to support that claim? There was a lot of assumptions made about this core stability, but they've never been proven. So in my method, we don't do any navel to spine hollowing, sucking or bracing the abdominals. What we're looking for is fluidity and ease of movement in the pelvis and in the lumbar spine area. Now, if we're doing navel to spine hollowing and bracing this area and then attempting to move, we're in effect, it makes it very hard to breathe and it makes it very hard to move functionally because you've braced this area. Now, what if we allowed that area to move and we allowed those muscles to engage, but in a very natural way, not in a way that is forced and contrived? And so I've never taught core stability work, but what I teach is natural engagement of the muscles. So I'm not saying those muscles shouldn't be working. I'm not saying abdominal muscles shouldn't be working. Of course they should, but they should be responding to the amount of work and load that you are putting through your tissue. Because the thing I really didn't understand about core stability, you know, we're told to engage our core when we go to an exercise class or we go to the gym. Now, do we do that just when we're at the exercise class and not do it for the rest of the week, the rest of our days? So how functional is that when you're only doing it in an exercise class? We want techniques and methods that are transferable into everyday life so that we can use that naturally without having to think, have I engaged my core? So those are my two observations over the years. And so now I'd like to invite you to try a couple of exercises which will involve breath. So breath is really, really important in helping relax those irritated, inflamed tissues that are causing the pain. We want to look at breath, we want to look at relaxation, we want to look at functional movement. So how are we actually moving on a daily basis that might be contributing to our pain? Now, if I can change the patterns, can I change the pain? So that's what we're going to be doing now. So I invite you to join me on the mat. So you just need a mat. You might need a head support. If you get neck pain when you lie down, if you're very tight in your spine, you're probably going to need a head support. So grab something to rest your head on and come and lie down on your mat or on the floor. And we're just going to do 5 minutes of exercise together just to give you a little introduction. I want to introduce you to exercises that maybe you're going to feel very different to what you've done before, where we look at these other concepts, which I found in my clinical practice have really worked before we attempt to do stability and strengthening work, when the tissue just isn't ready for it yet. Okay, so let's get settled on the floor. So as I say, grab a cushion if you need a cushion. Make sure you feel comfortable. You don't need shoes if you don't want shoes. That's absolutely fine. Come and rest your hands just on your torso, so somewhere around the base of your ribs, just for a little bit of feedback. And I just want you to notice how you're actually feeling. So even if you've got chronic low back pain, lying like this might already be uncomfortable. So feel free to put extra padding under your pelvis if you need to. Please do whatever you need to feel comfortable. It's super important that you start to feel safe so that your nervous system can start to feel safe. And go ahead and close your eyes if you feel happy to do that. And I want you to just take a couple of breaths, if you can, in through the nose and out through the nose if you can. And just be really present in your breath. So try and stay with that breath. Now all I want you to do as you continue to breathe is have in your mind this notion that the exhale, the letting the breath go, allows your body to kind of melt and sink into the floor. So it's a natural occurrence that when we exhale, the bones and the tissue get drawn down to the floor by gravity. You don't have to push or force yourself into the floor. If you've got a gap in your lower back, that's okay. Just feel as comfortable as you're able to do. And just bear in mind that as you exhale, the bones and the tissues are going to sink and you're going to start to feel a little bit heavier on the floor. And that's all you've got to do. You've just got to let go a little bit. And I want you to notice, because one of the first paths of creating healing habits and changing patterns and changing movement patterns is noticing where you're holding the tension. So as you're lying here, you might be thinking, well, my lower back still feels really tight. So you've got this spasming, contracting back muscles that are still holding on, even though we're in this relaxed position. And that's okay. You know, that's where your body is at the moment, and we've just got to breathe. And over time, we're going to encourage those guys to let go. Now, just move your hands down to your pelvis, so your hip bone area, without using a lot of force. Okay, we're not going to be engaging our core. We're not going to be doing any of that. We're going to feel the weight of the bones on the mat. And we're going to gently allow the pelvis to tip forward. I'll just move my hands so you can see. I've now got a gap in my back. And then we're going to allow the bones to rock backwards. And you'll see that I've now got a flat back. So I'm going to rock forward. And I'm going to rock backwards. Now look how small my movement is. Can you see how I'm moving just the pelvis? Now, what might be going on if you're blocked and stuck in this area? It might not look smooth. We might see something like this. Can you see how that's a lot jerkier, a lot bigger, less control? That is how the body kind of is moving at the moment. We want to encourage smaller, slower. So if you were doing the bigger version, I want you to reduce the effort and reduce the range of motion even more so that it gets quieter and quieter. Okay, so have a couple more plays with that. You may be finding that you're trying to push with your legs. You might be trying to push with your feet. See if you can isolate that movement into the pelvis. And you're giving yourself a little back massage by doing that. And then just come to stillness again. Take a breath. Remember, we get heavier as we exhale, so let the bones settle. And then just slowly walk your feet out to the edge of your mat, or a little bit wider than they were. Take your hands, palms up, a little bit wider. And this time we're just going to rock the pelvis to the side. So again, slowly, notice how slow I'm going. And then roll it back. And then we go the other way. Because in real life, the pelvis doesn't just move forward and back. In real life, the pelvis has to move from side to side, up and down. It can rotate. It needs to be able to do all these different movements. But maybe we've got ourselves stuck and the pelvis has lost some of its ability to move in all of those ranges of motion. Now, if that's happened, the tissues around the pelvis are going to start getting tighter, range of motion is going to start getting smaller, and you may start developing some pain. So if we can get movement into the pelvis without force, without bracing, we tend to find that things start to move a little better and pain starts to go down. Okay, so the pelvis and the movement, the freedom of the pelvis is super important when you're dealing with back pain. Okay, and please notice how small my movements are. I'm not letting my legs drop to the floor. Okay, I'm just rocking the pelvis from side to side. And then just come back to the middle, walk your feet back in. And then just to finish, we're going to take one leg and just give ourselves a little hug. Now this is just going to lengthen the lower back a little bit. So one side of the low back is getting stretched. So I'm just going to breathe and let the leg just feel heavy. And then I'm going to swap over. So again, no squeezing, no pulling, just breathe. Let your lower back feel heavy into the floor. And then just let it go. Then very slowly, just roll to your side to make your way back up to seated. So I hope that little video was helpful, giving you a different way of thinking about how to manage your back pain. Going low, going slow, totally different approach to maybe what we've been used to. So I'd love to know how you got on. Let me know in the comments below. And I hope to see you again soon on the Move Light channel.